Hey, friends. James Howell, one of the pastors here at Myers Park United Methodist Church, and we want to give you an update on things. I know you're hearing a lot from the news and so on about reopening and phases and all of this. And as we said, we're not going to be told by the governor or whoever when we're going to regather. We're going to consult with our medical advisory board and stay in concert with other churches and do what's really best, erring on the side of an abundance of caution. So I have three guests with me today to talk with you about this. One is Lauren Smith, who is our parish nurse. One is Dr. Joe Clifford, who's my neighbor at Myers Park Presbyterian Church. And then first, I want to talk with Dr. Sid Fletcher, who is heading up Novant's response to the coronavirus crisis. Sid, thank you for joining us. That's got to be a stressful thing that you guys are dealing with at the hospital these days.
Yeah, thanks, James. Obviously, it's been challenging times, especially for those that are on the front line of the work. But we're now seeing things kind of level off and feeling a little bit better about things, but also cautiously optimistic.
I hope Amy and your kids are well.
Doing great, thanks.
Good, good. Tell us a bit about this disease and how contagious it is. What people who think about coming back to church, being near each other, should think about. Like what are the dangers here? Talk about that.
Sure. So I think one of the things that you all have seen in the news is that I think what's challenging about this particular upper respiratory illness is it can be everything from having the illness and be asymptomatic, so be walking around without really showing any external signs or symptoms, or it can be something obviously much worse than that can lead to hospitalization or being in an intensive care unit on a ventilator, or obviously death. That gets people concerned. There are a number of risk factors as it relates to it, and I think one of the things about this illness is that it's actually quite contagious. Influenza, we think about the infectivity of something being if someone were in the environment that you're in, how many people would essentially contract that illness from that individual. And for the flu, it's somewhere around 1.2 people will potentially contract it from that person. For COVID-19, that's been somewhere around 2 to 2.5. So we know that it's particularly more contagious than traditional influenza, which is another kind of upper respiratory thing that I think a lot of people are familiar with.
And I was hearing something the other day about just shared air. If you're in the same airspace with people for a while, that makes it even more dangerous, not to mention things like singing, right?
That's absolutely true, James. So thanks for bringing that up. It's spread by respiratory droplets. Coronaviruses, we have a long history of knowing a lot about coronaviruses. Actually, they typically cause kind of cold URI type things. They're very heavy viruses, so they tend to fall to the ground fairly quickly. The 6-foot distancing thing that you've been hearing about is related to that, from the contact droplets. And then you pick those up, and obviously that's why you're not supposed to be touching your face. But as it relates to how infective it might be, it's really proximity and duration. So the closer you are to people and the longer that you're near them, the more potentially dangerous that environment can be. So the example I think about, I'm a runner, so I think about people thinking about runners going past them. They run past them quickly. They're there a matter of seconds. You're outside in an outdoor environment. It's actually probably low likelihood of any transmission. Change that environment to someone that you're sitting next to, especially in an indoor space, perhaps talking or singing, where we know we can suspend some of those droplets out into the environment around us. And then certainly that becomes an environment that's much more conducive to transmission of the virus.
I mean, if you saw our sanctuary, I know where you guys normally sit. It's packed up there. If you saw a sanctuary full of people, as a doctor, that would really concern you, I would imagine.
Yeah, that would be very, very concerning. And in fact, Mecklenburg County has been talking a lot about this, as well as, houses of worship. Obviously, fellowship is important in those environments. People would like to be back and seeing each other. I think The medical advisory group has been meeting and I think been thoughtful about what would reopening look like and what steps would need to be there. And we talked about screening. We've talked about physical distancing. I like to use physical distancing rather than social distancing. It's fine to be social with each other, just not in close proximity to each other. And then enhanced cleaning, things that you might want to think about. Masking, certainly it's helpful. And it's helpful in that those who may not have symptoms, but may actually be shedding some of those viral particles, if in fact they had COVID, would not be, at higher risk of transmitting that to others. And then obviously the other things that we think about are those in our worship community that are the most vulnerable. So we know those groups, right? Those that are over age 65, people with heart or lung disease, people with chronic immunocompromised states, including diabetes, cancer, things like that, that I think we'd have to be thoughtful about when those individuals would be able to return. We'd clearly be needing to look at the numbers that would be part of that. You certainly would want to keep the numbers low, and it really wouldn't resemble in an early state back to business as usual.
I just don't even know how to imagine. I did the math in our sanctuary. I think with proper, even minimal distancing, we could see 75 people in there. Like, who gets to come, who doesn't get to come? What would that service even be like? Singing is an issue. Sid, thank you to you and to our other doctors who are advising us. We're going to continue to rely on you. I've been so appreciative of all that you've shared with us. Let me turn now to Joe Clifford, who's the senior pastor at Myers Park Presbyterian. It's something that I've treasured my whole time being pastor here, is being friends with Joe and with the other pastors that are in our neighborhood. And especially during this crisis time, we've been meeting together and conferring, and we've committed to stay together on this thing so that, we're not worshiping then the Presbyterians or Doofuses for 9 additional weeks or whatever. Joe, talk some about how we're sharing in this journey together.
Well, it's been an incredible blessing to be able to think about the church's response to all this with one another, between Myers Park Methodist, Christ Church, Covenant Pres, First Pres, Myers Park Baptist, and us. It's been a terrific blessing to be able to think together about how we need to respond, and an even greater blessing that we're all on the same page in terms of wanting to provide the safest environment possible for people and the most fulfilling from a worship experience. And I think as we listen to Dr. Fletcher and as we think about what would it look like to have people sitting 6 feet apart with masks on, not able to sing, not able to greet one another personally, having to be temperature screened, waiting in line to get into the church, having to figure out who gets to worship and who doesn't get to worship. It's been a blessing to have the gift of virtual worship that is much more fulfilling, really, than what worship like that would be. So our session voted last night that we'll be continuing in virtual worship for the foreseeable future. And we look forward to continue to being in conversation so we can figure out the safest way for all of our churches to worship together.
I mean, I think we're doing well online. I miss seeing people, but people are finding creative ways to reach out. Like Sid said, we're made for fellowship with each other, not social distancing, but physical distancing. I think we're doing well. Our churches are doing well. I've sneaked a peek at your church. I think people are doing that back and forth. Can be an enriching experience. I meant to ask you when you came on, Joe, Jennifer and your kids, are your kids home with you?
My college-age kids, we were empty nesters and really starting to love that, and we aren't anymore. So, but it's a blessing to have the core four back with us. My wife also works for Novant, so I'm not seeing a lot of her. She's working hard to try to help fund initiatives that the hospital is engaging in and trying to support all the frontline workers. But I'm proud of her, and she's doing great work through these days.
I'm grateful for you, Joe, and the collegiality that we share and that our churches are in this together. I think that's what our people expect us to do. and love about what we're doing. Let me turn to Lauren Smith, who is our wonderful parish nurse on staff at Myers Park. She's actually this moment right down the hall from me. And Lauren, I hope you and John and your children are well, I hope.
We are, thank you. I feel much like Joe. I didn't have college age kids coming back, but I've got 3 boys at home all the time. So we were looking forward to college, and now we're just kind of in a pause mode as we all sit at home.
Mercy, mercy. So you've been, so it's interesting. A church isn't just about, when are we going to reopen and be back together, but there are health issues even when we're apart. And you and Reverend Bill Roth have been doing a series on pandemic resiliency. Say a little bit about that and how that helps people think about their mental and physical health during this time.
Absolutely. We know that all dimensions of our health and wellness are being impacted during this critical time, this very delicate season. And so every Tuesday at 1, Bill and I are doing a live stream that offers tips and strategies in dealing with different topics related to the pandemic and our own resilience in our health and wellness. Today's session that we just concluded just a bit ago was on anxiety and managing and coping with anxiety during this delicate season of pandemic.
I'm sure none of the people watching have anxiety, so that's probably not that interesting to. Everybody's got so much anxiety, right? It's hard. Lauren is our point person. Yeah, Lauren is our point person for all things medical. People are coming up with all kinds of questions. Can we meet in the parking lot? Can all these things? And just know that we are giving thoughtful attention to all of this at every point, consulting with doctors, consulting with area clergy, Lauren, our parish nurse, guiding us on that. If we err, we're going to err on the side of an abundance of caution. We love our people. We don't need to rush back together. We're connected in other ways. When it's safe, when it's good, we'll be together. We love our church. We love each other, and what an interesting season for us to grow and to love and learn and draw closer to God. And, builds character, builds goodness, builds faith. So, friends, thank you to Dr. Fletcher and Reverend Clifford and Lauren for being with me today, and thanks you folks for watching. And we will see you soon.